Hi, I'm Virginia from Write Clinic, and welcome to the Medical Writing Uncut podcast. Here with me today is Rachel. Thank you so much for being here.
Thank you so much. I'm really happy to kind of be here and speak to you today, Virginia. Thank you.
Thank you. I really appreciate you being here too. So let us know, what do you do and how did you get into it?
Yes, so I'm a freelance medical writer and kind of healthcare communication specialist. I've been doing this for some years now. So I started off doing writing jobs in around 2012. So before I was a medical writer, I did lots of different things. So I worked for, I don't know if you remember the company with the big yellow book, Yell, but I worked there for a while. I did various other kind of writing jobs. I worked for a camping startup once. But then I got my first writing job, or my first job in healthcare communications at a health economics consultancy. So that was back in 2012, I think. And after 2 or 3 years, that company was acquired by a big global CRO. So that's a clinical research organization. And I was moved into a team of strategic communications writers. So we were working on developing, shaping, and substantiating the value of different products. So that really gave me a great grounding while I was there in kind of how to communicate about the value of different medicines and different therapies in different disease areas. And so since then, I've kind of moved around various different writing and editing roles in the healthcare field. So I've worked for a health tech startup, which was really interesting in a rare diseases space. And I worked for a bespoke med ed agency. And then I spent 5 years at a healthcare communications agency. And when I was there, I kind of worked up to leading a team of writers and freelancers, which gave me a nice introduction to the world of freelancing. And then about 3 years ago, I chose to kind of make that leap myself and moved to being a freelancer. So not long after my first baby was born, I moved over to doing that. And so as a freelancer, I work on a variety of different types of project. So I put them under 4 headings. I do health content, so things like websites, social media copy, that kind of thing. I do meeting support, so mostly at the moment with patient advocacy groups, but I also work with different stakeholders like experts, key opinion leaders in different fields. I do some patient education and engagement work. And then I also work on what I would like to call medcoms, but generally that's where I work with agencies, and I work across more kind of traditional medical communications as well. So that's kind of everything from marketing copy, patient education materials, to mapping kind of stakeholder meetings and then writing the outputs from those meetings as well. So that I really love that, the kind of diversity as well that I get from doing my job. Yeah, does that answer your question?
Yeah.
Yeah.
Yeah, absolutely. Thank you so much. So would you say that you had no experience in kind of healthcare or any kind of like medical background before you started as a medical writer? Were your roots in kind of writing and that industry first, and then you kind of transitioned into the health and medical world?
Yeah, so I don't know. I think I'm probably one of those unicorns that came into this from a non-healthcare background. So I came from a writing background, I guess. I always wanted to be a journalist when I was growing up. So I've kind of, or a writer in some way, I've kind of got to doing what I wanted to do in a roundabout way. But yeah, so I started working in this field, I guess not completely by accident, but it's always been something I've been interested in, but I didn't come from a medical background. So I've had to work really hard to upskill, I suppose, but it has been, well, it's 2012, so nearly 14 years now in the industry as a writer. And while it's very difficult to do, I think as a freelancer, it's been good because I can sell myself and I can choose the projects that I want to do that fit my skill set. And I think it's all about kind of knowing what you're good at, and applying your kind of skills in that way. But there's been a lot of learning over the years as well. Certainly. Yeah.
Love that. Because I think a lot of people ask if you have to have a healthcare or medical background or some kind of science degree. And
Yeah,
I'm always encouraging them to say, yes, it is possible to get into medical writing. It's just going to be a bit of a learning curve. So I'm
definitely.
glad to hear that is, that was the
Yeah.
case for you and you kind of triumphed and you persevered and here you are and you're still in it, which is amazing.
Yeah.
And so what would be your kind of top tips for people who want to learn and they're from a non-medical or science background?
Um, so yeah, I think you definitely need to invest in your kind of learning, as it were. So really trying to kind of make sure you understand the most important things that you need, things like statistics. That's very difficult to learn, but you learn what you need to apply it to what you're doing. But also equally, I would say that you can kind of embrace versatility within being a medical writer. So there are so many different types of medical writing or health writing that you could choose to do. And I think my background shows you that, because I've gone from, working at a CRO to working at a startup to working at a med ed agency to working at a broader agency, all completely different. So I personally, I know people think different things about niching down, but I personally like the ability to do lots of different things, or within this field. So I would suggest not niching too early. Medical writing is a niche already. So explore what you can do. There's lots of different things. Coming to this without a science background or without a medical or healthcare background gives you a different perspective. So maybe that will mean that you can understand what a patient or someone from the general public needs to understand, or needs to know to understand something. You have maybe got that skill, or maybe got that kind of understanding that will help you to explain something that's really complicated in a simple way. And of course you need to understand that thing that thing, and in order to be able to explain it to that person, but maybe that will give you that skill a little bit more. Yeah, so I would suggest working with different types of people to find your fit and to find what you can do and what you're good at. Yeah, that would be my kind of top tip. But also just be adaptable, keep learning, and keep investing in your own kind of development as well.
Yeah, I really love that. And I think that's such a good perspective and a good mindset to have, that
Mm.
try and think what you have that other people don't. So
Yeah,
even when I ask my husband, oh, what do you think of this word, like contagious? He's like, oh, well, that's a scary word. And
yeah,
in a medical kind of field, contagious is just another word that we
yeah,
use,
totally.
but we don't see, yeah, how it looks like from the outside.
I think we,
So
yeah, sorry. I was going to say, I think we forget sometimes what we know, and how much we know, and about kind of these areas like medical language, for example. So that's something that you can bring to the table potentially to kind of help to make those things simpler, for example.
yeah, exactly. And you mentioned this word, which is med ed. And so
Yes.
for the audience, if you're not sure what that is, med ed is medical education. So do you want to explore a bit more about what that is?
Yeah. So in the context of where I was working, it's essentially creating materials or content that is education for healthcare professionals. So I was working for a publisher, or a med ed publisher that worked with GPs and also with wound care professionals. So that was my area. So we worked with nurses, podiatrists, people who specialize in diabetes, and GPs as well. So primary care professionals, to create materials that would support their continuing education. So that included a conference that we put on once a year. So I was involved in developing materials for the conference. So sessions, for example, of how to use a particular wound device. So it might maybe like a dressing, or the like benefits of different types of dressings that you can use in different situations. And then also webinars, and at the time lots of printed materials, because this was a few years ago, but which would be printed and brought to those conferences, but also that people could access via their website. And they also have a couple of journals as well, which I still write sponsored articles and thought leadership pieces for now, which is nice. So it's always good to have clients that you've worked with in the past, or people that you've worked with in the past that you can tap back into in the future. But yeah, so that's medical education in that context. And there's lots of different things that you can do in that field as well. Yeah.
Yeah, awesome. Thank you for sharing that. And I think also you touched on a really good point there where your relationships in the long term really matter. So try and think of how long you want to work with this person and make sure that you are delivering your best work, and you're always, mindful of how you communicate with them and make sure you're timely and
Yeah.
that kind of thing. So what's next on the horizon for you? What are you planning for in the future?
Yeah. So in the very close future, today's my last working day before a holiday, so I'm I'm taking some break with my kids over the summer, which is one of the best things about being a freelancer. If you plan it, you can take some time off, which is good. And then I'm booking up at the moment for the next quarter, so I've already got quite a few meetings booked in, mostly patient meetings, which will be really interesting. A couple of them are traveling, which is nice. So nice to have some trips on the horizon. And then in addition, I'm looking at kind of expanding my mentoring services. So I offer mentoring for medical writers at all different stages of their journey. So I've mentored kind of very early stage writers and very experienced agency writers, for example, who want to go freelance, and everyone in between that, really. So I'm looking at kind of expanding that. And I'm also working at the moment on a nonfiction book as well. So that's coming up in the next few months. So I'll be kind of tapping away at my keyboard, getting that ready. That's a book for patients and the general public about making sense of health information. So that's on the horizon as well. And hopefully it'll be
I
finished
love that. I really
soon. Yeah. Yeah.
Sorry, I didn't catch that. Say
I
that
said
again.
hopefully that will be finished soon. Yeah, it's a big job. Anyone who's kind of worked on a book before will know that. But yeah.
Yeah, that sounds really exciting. And I'm hoping that you have a lovely holiday
Thank
with
you.
the kids. And yeah, I really look forward to reading your book too. So if you want to connect with Rachel, then you can follow her on LinkedIn. You can also check out her website, and I'll leave that all linked in the description box below. So thank you so much, Rachel, for being on the podcast today.
Thank you so much for inviting me, and everyone for listening as well. Thank you.
Thank you, everyone, for watching or listening, and we'll see you at the next episode. Bye.